Dr. Kouvelos, and another very interesting and controversial case, please.
Thank you very much, dear Chairman, dear colleagues, ladies and gentlemen. Our case concerned a 77-year-old male who suffered during the last 3 months 4 acute myocardial infarctions with no possibility for PTCA or CAPACH. He had also pulmonary fibrosis, hypertension, COPD, coronary artery disease, of course, and hyperlipidemia. During his last cardiac workup, a large AAA of 8.5 centimeters, bilateral common iliac aneurysm to the right side 4.5, to the left 6.5, as well as a left internal iliac aneurysm of 2 centimeters were found. The patient, of course, was turned down for treatment from several hospitals. In these axial CTs, we can see the AAA and the common iliac artery aneurysm. And here's the 3D reconstruction of the whole aorta. And given the history of the patient, we decided for a standard for endovascular procedure. So we can see there were 2 severe angles. The first angle, infrarenal angle of 82 degrees, and the second suprarenal angle of nearly 90 degrees. So here are the measurements. We have an adequate neck length. We also have 200 millimeters aortic bifurcation. And here's where we planned for the flow diverter, and here's when we planned for the contralateral limb to open. This is the right side, and here's the left side. So given, and we can see the simulator of DSA simulator given by the 3D reconstruction program, the proximal neck. Here's the aortic bifurcation with the 2 iliacs, and here's the external iliac artery as it was shown in the angiography. And here is the simulator image where the program shows us where the contralateral limb will open. So based on this sizing, we decided for an endural Medtronic endograft with a left axis with a main body of 32 and 170 millimeters. These contralateral limbs for the right iliac artery, for the right common iliac artery, and a left extension to the external iliac artery by using an endurant limb and an excluder limb to the external iliac artery. We also decided to embolize the left internal iliac artery aneurysm with a vortex vascular occlusion coil, which is long, around 2 centimeters. So in the first step, we contralateral embolize the left internal iliac artery aneurysm, and here's the result. At the second step, we deployed the main body endograft and open it, just flush to the renal arteries. And then we cannulated the contralateral limb from the other side. And after the cannulation and the deployment of the right iliac limb, we saw that there was a little slip, a little jump of the main graft, just a few millimeters. So we decided for an aortic cuff that was deployed just flush to the renal arteries with a very good result. And at the final stage, we went across the orifice of the internal iliac artery, covered it, and went to the external iliac artery at the left side with an excluder endograft. So the operation was around 3 hours. The blood loss was 250. The contrast media used was 200 millimeters. The exposure were nearly 500 milli-GY, and the time exposure was 70 minutes of radiation. The patient has a post-implantation syndrome for 3 days. He had no cardiac complications. He was almost immediately ambulatory and was discharged home the 6th post-operative day. At the first month of follow-up, his clinical evaluation was very good, no problems, no bad claudication. His blood tests were okay, and he had no more fever. The CT scan showed an adequate sealing at the proximal sealing zone, no sign of endoleak. And here's the 3D reconstruction where we can see the ballerina configuration which was not intended but was created by the high and severe angulation of his aorta. And here's the limbs, the right limb to the common iliac artery and the left limb to the external iliac artery. So we may conclude that endovascular repair of aortic aneurysm with severely angulated neck is rather challenging. By choosing flexible stent grafts and suitable techniques in carefully selected patients, an encouraging outcome can be achieved. Of course, meticulous preoperative planning is mandatory. Different endografts combination might prove beneficial. Of course, long-term data are needed to verify these short-term encouraging results. Thank you very much for your attention. And you are welcome to come to Ioannina the next year.
Thank you very much, Dr. Kouvelos.